The silver tsunami, a growing tide of chronic illness. America is aging. By 2030, 1 in 5 Americans will be over 65. This demographic shift, often called the silver tsunami, brings a wave of healthcare challenges. Chronic diseases like heart disease, cancer, and diabetes are more common with age. The rise in these conditions puts immense pressure on our healthcare system. The cost of managing these illnesses is significant, and the demand for specialized care is rapidly increasing. As we age, we need to rethink how we deliver and pay for healthcare. The prevalence of chronic diseases among older adults is staggering. Conditions like arthritis, hypertension, and dementia impact quality of life and strain resources. These illnesses often require long-term management, multiple medications, and frequent doctor visits. This complex care landscape necessitates a shift from treating acute illnesses to managing chronic conditions. The current system, often fragmented and reactive, struggles to meet these evolving needs. The increase in chronic illness also has profound implications for long-term care. Many older adults require assistance with daily activities due to chronic conditions. This demand for home health aides, assisted living facilities, and nursing homes is soaring. However, the availability of affordable, high-quality long-term care options lags. This gap between need and availability poses a significant challenge for aging Americans and their families. Addressing this crisis requires a multi-pronged approach. Prevention and early detection of chronic diseases are crucial. Promoting healthy aging through lifestyle changes such as diet and exercise can reduce the burden of chronic illness. Additionally, we must invest in research to find better treatments and cures for these debilitating conditions. The future of healthcare depends on our ability to effectively manage the rising tide of chronic illness. Healthcare inequality, a tale of two Americas, growing older. Access to quality healthcare in the United States is not equal. This disparity is particularly evident when we look at aging populations. Socioeconomic factors such as income and education play a significant role in health outcomes. Older adults living in poverty often lack access to nutritious food, safe housing, and transportation. These social determinants of health contribute to higher rates of chronic disease and premature mortality. Geographic location also plays a crucial role in healthcare access. Rural communities often face a shortage of healthcare providers and hospitals. This scarcity makes it challenging for older adults in these areas to receive timely and specialized care. Traveling long distances for appointments can be physically and financially burdensome. This geographic disparity exacerbates existing health inequalities and highlights the need for innovative solutions to improve access in underserved areas. The digital divide further complicates access to healthcare for some older adults. Telehealth has emerged as a promising tool to bridge geographic barriers. However, many older adults lack access to reliable internet or the digital literacy to utilize these services effectively. This digital disparity limits their ability to access virtual consultations, remote monitoring, and online health resources. Bridging the digital divide is essential to ensure equitable healthcare access for all aging Americans. The fragmentation of the U.S. healthcare system adds another layer of complexity. Navigating various insurance plans, specialists, and care settings can be daunting for anyone, especially older adults with multiple chronic conditions. This fragmented system often leads to miscommunication, duplicated tests, and delayed care. A more integrated and patient-centered approach is needed to address the unique healthcare needs of aging Americans. Where have all the geriatricians gone? The aging population requires specialized care, yet America faces a critical shortage of geriatricians. Geriatrics, the branch of medicine focusing on older adults, is a demanding field. It requires a deep understanding of complex medical conditions, polypharmacy, and the social aspects of aging. However, medical students often choose higher-paying specialties, leaving a gap in geriatric care. The shortage of geriatricians has far-reaching consequences. Older adults may experience longer wait times for appointments, difficulty finding a geriatric specialist, or receive care from providers without specialized training in aging. This lack of specialized care can lead to misdiagnosis, inappropriate treatments, and poorer health outcomes. Addressing this shortage is crucial to ensure that older adults receive the compassionate and comprehensive care they deserve. Several strategies are being implemented to address this workforce crisis. Medical schools are offering more geriatrics training and increasing the number of geriatric fellowship positions. Loan repayment programs and scholarships are being offered to incentivize students to choose geriatrics. Efforts are also underway to raise awareness among medical students about the rewards and challenges of caring for older adults. However, attracting more geriatricians is only part of the solution. We need to empower other healthcare professionals to provide high-quality care to older adults. This includes training nurses, pharmacists, physician assistants, and social workers in geriatric principles. Interdisciplinary teams, working collaboratively, can better address the complex needs of aging patients. By expanding the geriatric workforce, we can improve access to care and enhance the quality of life for older adults. Section 4. Bridging the Gap Intergenerational Programs for Aging Support. Intergenerational programs connecting young and old offer innovative solutions to support aging populations. These programs create meaningful connections that benefit both generations. For older adults, these programs combat social isolation, a growing concern linked to various health problems. Interacting with younger generations provides a sense of purpose, reduces loneliness, and improves mental well-being. These programs take many forms, from mentoring and tutoring initiatives to shared arts and cultural experiences. For example, some programs pair older adults with young children for reading sessions or storytelling. Others involve older adults volunteering in schools or community centers, sharing their skills and experiences. These interactions foster a sense of community and provide valuable support for older adults. The benefits for younger generations are equally significant. Interacting with older adults teaches empathy, respect, and understanding of aging. It exposes them to different perspectives and life experiences, broadening their horizons. Mentoring programs where older adults guide and support younger individuals can be particularly impactful, providing guidance and role models. Intergenerational programs also offer practical solutions to address the growing demand for aging services. Volunteer-based programs can provide companionship, transportation, or assistance with daily tasks, reducing reliance on formal care systems. These programs offer a cost-effective way to supplement existing services and provide essential support to older adults in their communities. By fostering these intergenerational connections, we can create a more supportive and inclusive society for all ages. Section 5. Securing the Future of Aging in America. The aging of America presents significant challenges and opportunities. Our healthcare system must adapt to meet the needs of a growing older population with complex health needs. Addressing health disparities, bolstering the geriatric workforce, and fostering innovative solutions are crucial steps in the right direction. However, securing the future of aging in America requires a broader societal shift. We must move beyond viewing aging as a problem to be solved and embrace it as a natural stage of life. This requires creating communities that are age-friendly, accessible, and supportive of older adults. Investing in public transportation, affordable housing, and community centers can help older adults live independently and engage fully in their communities. Promoting healthy aging through lifestyle interventions, disease prevention programs, and access to quality health care is essential. Empowering older adults to take an active role in managing their health and well-being is critical. Creating a society that values and supports its aging population is not just a matter of compassion, but also of economic and social imperative. As we navigate the challenges and opportunities of an aging America, we must remember that older adults are not a burden, but a valuable asset to our society. Their experience, wisdom, and contributions enrich our communities in countless ways. By investing in their well-being, we invest in a stronger, healthier, and more vibrant future for all Americans.